Week 3, Foundations of Evidence-Informed Practice. This is PowerPoint number 1, and this is all about observational research. Let's do a little review. So, what is biologic plausibility? You should be able to answer this question. It means, does this make sense that a study or intervention could work? So how do we determine if something is biologically plausible? We do that through basic science research. So how do we determine the effectiveness of an intervention in clinical research? We use outcome measures. We'll talk more about this in coming weeks. What is a hallmark of qualitative research? Again, you should know this for your final exam. The hallmark is open-ended questions. It's the way that someone describes a condition, describes their symptoms, describes their outcome. And what's a hallmark of a quantitative study or research? These are really directed questions, so it's based on numeric terms. 1 is yes, 2 is no, 0 to 10, how would you rate your symptoms, things like that. A little bit more review. So, results from a pure science study are immediately clinically applicable. Is that true or false? You're right, it's false. Next question, a different study looks at the reason clients choose to return to a massage therapist after their first session. Is this a qualitative or quantitative study? That's right, it's qualitative because we're looking at the reasons why a client chooses to return to a massage therapist. Another study looks at the percentage of pain reduction when a client with ALS gets 1 session of massage. So is this one qualitative or quantitative? That's right, it's quantitative because we're looking at the percent of pain reduction. Last question, what does clinical equipoise mean and why is it important when conducting research? Should be able to answer this question. Again, it will be on your final exam. Let's take a look at different types of research. So laboratory studies, which are down here towards the bottom, are not really our concern. Editorials, it's not rigorous enough for our purposes. We will talk a little bit about editorials here in a couple of weeks, but really what we're focusing on in this class are case reports or case studies, case series, case control, cross-sectional, cohort, and randomized clinical trials. That's what this week is all about. In the coming weeks, we'll talk more about systematic reviews and meta-analysis. Observational research answers these types of questions. How common is a disease in a given population? What exposure risks increase the risk of disease? What is the association between exposure and effect? Association is an exposure possibly related to an outcome, but a problem that people get into, a confusion that people get into is remember that association does not equal causation. Some of the other things that observational research does is it uses demographics, effectiveness, adverse events, prevalence, and cost. With our observational research, so what does it mean? Observation of a subject or subjects, an individual or a group. It uses empirical methods to collect data. Empirical methods means that you're using your senses. And there are really 5 types of observational research. There's case report, case series, case control, cross-sectional, and cohort or longitudinal. That's what this first PowerPoint is really about, is those 5 types of observational research. So observational research case report. So the first thing is that a case report is usually done on a unique case in clinical practice. It's usually one client or one patient. Could be one session or it could be several sessions, but it's usually, again, really focused on just that one client. These can either be prospective or retrospective. Remember what that means. So prospective means that we're following the person. We're doing it from this point forward, whereas retrospective means that we might pull a case file and take a look at something that was done over a couple of sessions to find out maybe why this particular intervention seemed to work. With a case series, it's observation of a series of patients without a control group. So the similar population, they will receive similar treatment. Now these can also be either retrospective or prospective. The third type of observational research is a case control. So we begin with a group of cases who have a similar outcome. These cases are compared to a control group, but they don't have the outcome, right? So that's our control group. They all have similar demographics, but this group lacks the condition or the outcome. These are done to see if there are differences due to exposure. And again, these can be either retrospective or prospective. Cross-sectional, we're looking at a snapshot or cross-section of a specific population. Example, the health or behavior at a specific point in time. The U.S. Census is a really good example of cross-sectional because we're doing this once every 10 years, gathering data about the U.S. population. Can be people with the same or very similar demographics, and this can either be prospective or retrospective. Now the last one, a cohort or longitudinal study, is that we start with a large group of people with similar demographics, but they don't have any kinds of condition. The researchers are really looking to follow a group over a long period of time to figure out if they develop certain types of conditions and perhaps why. They're gathering a tremendous amount of information about this group. The participants have not developed any outcome of interest as of yet, but that's again something that they're just following them to see what happens, what maybe types of lifestyle habits may create certain outcomes in a specific population. By definition, these are prospective because you're following that group over a period of time. That's the end of part 1. Don't forget to watch the second PowerPoint.